Hello, and welcome to the hospital. I'm Nurse Nathan, and this is Terry.
Hello.
While you're here, we don't want you to worry and to feel you just have to lie there and let it all happen. The way we see it, you're an important member of the team taking care of you. So relax while I and some of my colleagues tell you the 4 ways you can help with your own well-being. Starting with...
Number 1.
Yes, thank you, Terry. Number 1. Participate. Always remember you're at the centre of the healthcare team looking after you. So it makes sense for you to be an active member of the team. For instance, feel free to ask your doctor questions and discuss your treatment with him. Or her. Half of our doctors are women, as a matter of fact. Yes, participate. Now, for the team to work really well together, there's...
Number 2.
Yes, thank you, Terry. Number 2. Inform. Here's Sister Naples to inform you why the information you give us about yourself is so important.
Hello there. The information you give us is absolutely vital. That's why we ask you for a full history when you first come in, because we need to know all about you. It begins with confirming who you are and what you'd like to be called. We need to know that before we can start treating you. We also need to know about all the medicines you're taking and if you're allergic to any drugs. And please keep the information coming during your stay. It could be that you don't like your food or that you've lost your appetite. This can affect your recovery, so please tell us. And telling us exactly how you feel is really helpful. And don't always wait to be asked how you are. If you're in pain, tell us, and we can give you painkillers. We need to make sure you're pain-free so you make a good recovery and take part in treatments, like physiotherapy. I have to get along to the next ward now. Terry here is going to take you along to number 3.
Number 3, notice. Something I do a lot as I go around the hospital. I notice stuff. And if you notice something important that one of us or a doctor or nurse has missed along the way, speak up.
Hey, and if you notice somewhere that needs a bit of an extra clean, tell us.
Good example, Phil.
Or if you notice a member of the team not washing their hands between beds, please mention it to them. Also, visitors need to wash their hands and they shouldn't sit on your bed. Notice if you haven't been given your regular medication, or if you haven't managed to take a bath or have a wash, or been able to clean your teeth, because your own hygiene is very important to your recovery. One thing you'll notice now is that we're coming up to number 4.
Number 4.
Yes, thank you again, Terry. Number 4. Know. Know as much as possible about your treatment and how to stay healthy, like knowing that you'll be given nothing to eat before being given an anaesthetic, that it's quite normal to have your temperature, pulse and blood pressure checked frequently throughout the day, so there's no reason to be concerned, that wearing those special long stockings we hand out is good for the circulation. Now, I know they're not fashionable, but they do need to be put on properly. Knowing not to touch your wound whilst it's healing. Knowing that if you smoke, it's no help to you at all. You also need to know that you have every right to complain. Here's someone who knows a lot about a lot. He's a surgeon, so he's called Mr., not Doctor. Good morning, Mr. Jones.
Very kind of you. Actually, a lot of what I know I learnt from patients who knew, if you follow. The stuff they told me helped me form a better diagnosis. Also, patients in the know are better prepared for recovery after treatment. Take a patient who knows about the benefits of a little bit of exercise. He or she takes a walk up the ward, nothing too strenuous, flexes a few joints and takes a few deep breaths in and out, giving their lungs a stretch. Now that's a patient who's really helping speed up their own recovery. So, try and feel in the know as much as possible. And what if you think you don't know something? Please ask. Ask a nurse, ask a doctor. We're a team, including you. And getting you better will be a team effort.
Thanks, Mr. Jones. Well worth knowing. So there it is. 4 ways to help yourself with your well-being in hospital.
Participate.
Inform.
Notice.
No.
P-I-N-K.
Think pink. And think being in the pink.